for a resolution of Parliament urging government to recognize the sickle cell disease as a major non-communicable disease that requires urgent public health intervention. Patron Speaker, we move the motion with a lot of emotion. As victims, as carriers, but also as concerned citizens. Patron Speaker, whereas the national objectives and direct principles of state policy of the 1995 Constitution enjoin the state to take all practical measures to ensure the provision of basic medical services to the population, and whereas the 59th World Health Assembly that was held on the 27th of May 2006 under Resolution 5920 on sickle cell anemia expressed concern that the global mortality and morbidity caused by sickle cell disease, particularly in developing countries, as well as the suffering experienced by patients and their families, among others, aware that following the 59th World Health Assembly, member states in which sickle cell anemia is a public health problem were urged to design, implement, and systematically reinforce comprehensive national integrated programs for the prevention and management of sickle cell anemia, including surveillance, dissemination of information, awareness raising, counseling and screening, among others, noting that in 2016, Uganda was reported to have a significant burden of sickle cell disease, with a national sickle cell trait prevalent at approximately 13.3%, indicating that about 1 in 7 people is a carrier, while the prevalence of sickle cell disease was estimated at around 0.8%, with notable regional variations. Further noting that sickle cell disease remains a public health concern prevalent in Uganda and a contributor to child mortality, with about 20,000 babies being born with the sickle cell disease annually, and approximately 6,000 to 9,000 children dying before their 50th birthday, largely due to lack of early diagnosis and inadequate access to comprehensive care. Aware that treating sickle cell disease imposes a significant economic burden on the patients and their families, especially given that according to the disease trends reported in the Ministry of Health Annual Health Sector Performance Report 2022-2023, hospital admissions of sickle cell patients increased by 28.5%. Cognizant of the government interventions through the Ministry of Health in the fight against sickle cell disease, including mandatory sickle cell screening for all newborn babies, implementing targeted screening in high prevalence regions, integrating sickle cell disease treatment within the non-communicable diseases department, and institutionalizing sickle cell disease services within the national health system, concerned that despite the government efforts to combat sickle cell disease, inadequate resource allocation and limited investment in sickle cell programs continue to contribute to increasing prevalence and sustained mortality, further concerned that the sickle cell disease remains one of the most traumatizing genetic diseases, resulting in significant psychosocial and economic consequences for patients and their families, including recurrent painful cries, chronic medical complications, increased morbidity and mortality, frequent hospitalization, reduced quality of life, social stigma, disrupted education and employment, and considerable financial strain due to long-term care and treatment. Now, therefore, be it resolved that Parliament urges government, 1, to recognize the sickle cell disease as a major non-communicable disease that requires urgent public health intervention, and 2, provide adequate funding to facilitate mandatory screening, treatment access, research, and public awareness, and number 3, to strengthen the sickle cell disease awareness campaign to educate the public on the genetic nature of the disease to prevent transmission of the disease. I beg to move, Right Honourable Speaker.
Is the motion seconded? By the whole House. But I can mention Dr. Yume, Honorable O.O., Patrick, Dr. Bedi, Dr. Lulume, Dr. Ginger, the leader of opposition, Honorable Solo, Honorable Christine, Honorable, I'm looking at Honorable Ikojo, Honorable Angura, Honorable Orone, Honorable Giovannis, Honorable Goli, Honorable my friend Fox is there. Honorable Ferigo Nalongo is also there. Honorable Kavanda, Honorable Chemongesi, Honorable Dubai, Honorable Dr. Nekesa, Honorable Charity, Honorable Ethel, Honorable John, Augon, Noah, Gabriel, and you putting me under test by the whole House. Yes, would you love to speak to your motion?
Thank you very much, Right Honourable Speaker and colleague members of Parliament. Right Honourable Speaker, in the motion that I tabled, I spoke to certain statistics that I want to highlight further in justifying the motion, Right Honourable Speaker. Right Honourable Speaker, according to the statistics from the Ministry of Health, Uganda globally takes the 5th position in the sickle cell prevalence, and we are 3rd in Africa. And as I mentioned, Right Honourable Speaker, about 7 million Ugandans carry the sickle cell trait, and it is across the regions of this country. Particularly in Lango, Alebutong is most affected. Right Honourable Speaker, in Busoga, Namutumba, in Rwenzori, Bundibujo, in Bunyoro, it is Bulisa. In Teso, it is Amuria with the prevalence of about 24%. Right Honourable Speaker, other places like Bujiri, where I come from, is about 22.7%. In Katakwi, it's about 20%. In Chikube, about 33%. In Bulisa, about 26%. Right Honourable Speaker, and as I mentioned, about 9,000 babies die before 5 years. Right Honourable Speaker, the statistics I am adumbrating don't relate to forests. They are not about stones. These are statistics about human beings and wananchi that are affected by this disease. Right Honourable Speaker, these statistics have been exacerbated by the inadequate funding of this disease and the fact that increasingly there is declining development aid towards the health sector because most donors, Right Honourable Speaker, are not interested in funding non-communicable diseases. And Right Honourable Speaker, as I highlighted, the burden on families and household income is immense, arising out of the cost of treatment of this disease. Right Honourable Speaker, we all recall the case of a lady, Hope Fortunate Achiro, who spent about 2 billion shillings treating her 2 children in India, but who unfortunately passed on. You can imagine spending such amounts of money, but still your children died. Right Honourable Speaker, at a political level, there are increasing community fundraising and funding requests from even us, members of Parliament, from families that have been afflicted by this disease. Because ideally, you require between 300 million to 1 billion to travel abroad, especially to India, for this treatment. For the burden on us, even as MPs, is enormous, arising out of this disease. Right, Honourable Speaker, there is increasing stigmatization of the affected persons and increasing domestic violence, especially among women and children, who actually looked at as the cause of the disease in the family. You know, Right, Honourable Speaker, in most of our traditional and chauvinistic families, when there are ailments of this nature, they are attributed to the women as the cause. And that is in the public domain. And as a result, it is increasing domestic violence in some areas. Right, Honourable Speaker, in our schools, sickle cell warriors are mismanaged due to lack of awareness, training, and basic facilities that are needed to make these schools safe places for the learners. And simple actions like removing sweaters from learners can deteriorate their health and could potentially lead to loss of lives. But because there is no awareness, you find school authorities actually implementing such kind of actions to the detriment of the children. Right, Honourable Speaker, we also want to mention that there is no specialized medical doctors for adolescents and adults with sickle cell disease. All specialized sickle cell treatment in the country is actually undertaken by pediatricians. This causes more stigma to the adults that are seeking treatment and actually more congestion in the pediatric clinics for the sickle cell. Right, Honourable Speaker, we also want to take note that unlike HIV, we don't have a sickle cell registry in the country, and it is because of a lack of a structured testing program. In light, Right, Honourable Speaker, of what we have mentioned, we urge government and this parliament to consider a raft of interventions for purposes of addressing this scourge. But, Right, Honourable Speaker, all this can be possible if there are resources that are dedicated and committed. And therefore, it is incumbent upon us as Parliament to consider that while debating this motion.